Welcome back to another Deep Dive Med, everybody. You ready to get our lungs working a little better today?
Sounds like a plan.
Awesome. Today we're talking about aerosol delivery of medications, specifically for respiratory diseases. Like, imagine getting medicine straight to the spot in your lungs where it's needed most. That's what we're diving into, how it all works, why it even matters, and what to watch out for.
It really is a fascinating intersection of pharmacology and respiratory physiology. How do we get those drugs exactly where they need to go?
Okay, so right off the bat, our sources keep mentioning these terms: stability, penetration, and deposition.
Hmm.
They all seem pretty important in making sure this aerosol delivery actually, works. Can you break those down for us?
Absolutely. Think of it this way. Our goal with aerosol medications is to get them to those alveoli, those
Hmm.
tiny little air sacs way down deep in your lungs. That's where the magic of gas exchange happens.
Right, right.
But it's a journey.
Oh, for sure.
So stability is all about how well the medication actually stays airborne in those tiny aerosol droplets.
Okay, so like how long the bubbles in soda last. We need those droplets to hang in there long enough to reach their target.
Perfect analogy. Then we've got penetration, which is how far those particles actually travel down into the respiratory system. You want them to reach those alveoli, but the airways can be a bit of an obstacle course.
It's like a microscopic obstacle course
Yeah,
right inside our lungs.
exactly. And sometimes those particles, especially if they're larger or moving too fast, get knocked off course. They hit the walls of those airways before they reach their destination. That's where deposition comes in. It's the actual process of those particles settling out from the airstream and landing, hopefully, on the lung tissue where they need to be.
Oh, I see. So it's not enough just to get the medicine in there. It has to get to the right spot.
Yeah.
This makes me think about when we use an inhaler, we're always told to take that deep breath and hold it afterward, right? Is that connected to deposition?
Absolutely. That breath hold is like gold when it comes to maximizing the effectiveness of the
Oh,
medicine.
really?
It gives those particles time to settle deep into the lungs, particularly those alveoli.
Makes sense.
Without that pause, you're risking a lot of that medication depositing in your mouth or throat instead of where it needs to go.
So we're basically giving the medicine a chance to, like, make a smooth landing in the right spot.
Exactly. Now, speaking of getting medicine to the right spot, let's talk about spacers, especially for children.
Oh, yeah, spacers. Those things are kind of a mystery to me. Why are they so important?
Spacers are a great example of a single tool that has a huge impact. First of all, they help with coordination.
Coordination.
Yeah, remember timing is key with an inhaler, right?
Oh, right,
You
right.
got to actuate it at the exact moment you start to inhale. But spacers make that easier. You can breathe more naturally. Don't got to worry so much about hitting that perfect split-second timing.
So it takes some of the pressure off, lets you breathe comfortably, and still get the meds where they need to go.
Precisely. Think of it like a buffer zone. But there's more. Spacers also help to vaporize the medication. This makes it way easier to inhale, and it ensures those particles are that ideal size to reach the alveoli. We're talking about a sweet spot between 1 and 5 microns. One of our sources had this cool visual that showed how particle size directly affects where the medication lands in the airways.
Interesting. So particle size is a factor too. Now, this all makes me wonder about the potential downsides. If we're talking about delivering these higher doses straight to the lungs, could there be more side effects?
Absolutely a valid concern. One of the common medications we deliver this way is albuterol.
Albuterol, right.
It's a bronchodilator, and it's super effective. But because it's absorbed so rapidly via aerosol, the side effects can be more pronounced, especially at higher doses.
So even though it's a very common medication, we need to be extra mindful of those side effects when it's delivered this way.
Precisely. We're talking things like rapid heartbeat, irregular heart rhythms, even potentially low potassium levels. Our source had some ECG images, and those really drove this point home.
Okay, those ECG images are definitely a good reminder that careful monitoring is key,
Hmm.
especially with higher doses.
Exactly. It's all about finding that sweet spot where we maximize those benefits, but also minimize those risks.
Right. Now, switching gears a bit, let's talk about the types of medications we can deliver this way. Our sources mentioned quite a few: bronchodilators, mast cell stabilizers, corticosteroids, mucolytics, even antimicrobials.
It's pretty amazing, right? We've got a whole arsenal of medications that we can aerosolize to tackle all these different respiratory issues.
That is pretty cool.
You mentioned bronchodilators like albuterol, which are our go-to for opening up the airways in things like asthma and COPD. Then there's mast cell stabilizers like crumlin sodium or Intel is the brand name.
Hmm.
And those help prevent allergic reactions in the airways.
Oh, so instead of taking a pill, you're inhaling this medicine that goes directly to those specific cells that are triggering the allergic response.
Exactly. And then there are the corticosteroids like fluticasone, which are powerful anti-inflammatories, also really important for managing asthma. It's so targeted. It's incredible how targeted this can be. What about those other categories you mentioned, like the mucolytics and antimicrobials?
Mucolytics, things like acetylcysteine or mucomist, work by thinning out the mucus, making it easier to cough up. This is super helpful for conditions like cystic fibrosis or chronic bronchitis.
So if you have a lot of phlegm, this helps clear things out.
Exactly. And then finally, antimicrobials. These can be antibiotics or antivirals, like ribavirin, which is sometimes used for those nasty RSV infections.
Wow, so many different medications that can be delivered this way. It really opens up a lot of treatment options.
It really does. But with all these options, we need to make sure that patients are actually using their inhalers correctly.
Right.
Otherwise, all this is for nothing. The medication might not reach its target effectively.
That's a great point. So let's talk technique. Our sources talk a lot about meter dose inhalers or MDIs. What are some key things to keep in mind to make sure you're using these correctly?
Well, first and foremost, timing is everything.
Time. Yeah, you got to press down on that inhaler. That's called actuating it. At the exact moment you start to inhale slowly and deeply.
So no quick puffs.
Nope. We want a nice, smooth, steady flow of air to carry those particles deep down. Breathing too quickly can actually make those particles more likely to deposit in those upper airways where we don't want them.
So there's a real art to using these things.
Yeah.
What other tips do you have?
Always shake that inhaler really well before each use.
Okay.
And if it's a new inhaler you haven't used in a while, you got to prime it.
Prime it.
Yeah, release a few puffs into the air. This ensures that medication is flowing properly.
Oh, so those test puffs aren't a waste. They're actually important to make sure the medication is ready to go.
Exactly. And of course, don't forget that all-important breath hold that we talked about. After you inhale the medication, hold that breath for a good 10 to 15 seconds.
Right.
Let those particles really settle deep in those lungs.
Okay, so timing, slow breaths, shaking the inhaler, priming it if needed, and then that breath hold. Got it. Now, our sources also talk about dry powder inhalers, or DPIs. How do those differ from the MDIs?
DPIs are kind of cool because they rely on your breath to deliver the medication.
Interesting.
Instead of a propellant like in an MDI, the medication is in a dry powder form. So to get it into your lungs, you actually need to take a really strong, fast inhalation.
Oh, so less about timing and more about the force of your breath.
You got it. But this can be tricky for some folks, especially those with weaker lung capacity or if they have difficulty following instructions.
Makes sense. Not everyone has the same lung power. So are DPIs just not suitable for certain people then?
Well, it really depends on the individual and their condition. Our sources really stress how important it is to do a patient assessment before prescribing a DPI. We're talking mental status, neuromuscular weakness, even their ability to follow directions. All these things come into play.
So it's really important to consider those individual factors before deciding on the best type of inhaler for each person.
Well,
What are some common DPIs that people might come across?
two of the most popular are the Discus and the HandiHaler.
Okay.
The discus, which is often used for medications like Advair, has this rotating disc that you slide to prepare the next dose. And then you've got the HandiHaler, often used for Spiriva, where you actually load a capsule into the device, pierce it, and then inhale.
It sounds a bit more complex to use than an MDI.
They can be, especially for our elderly patients who might have dexterity issues or have trouble handling those small parts. Patient education and support are crucial, regardless of what type of inhaler is being used.
That's a good point. It really highlights the importance of that communication and guidance between healthcare providers and their patients. Speaking of different types of devices, let's talk nebulizers. Our sources mention that not all nebulizers are created equal. Can you elaborate on that?
Absolutely. Think of it as like a nebulizer hierarchy, with some types being more efficient than others. At the top of that hierarchy, you've got your mesh nebulizers.
Mesh nebulizers.
Oh, yeah.
Okay. So what makes them so special? Why are they top tier?
Well, mesh nebulizers are incredibly efficient at delivering medication.
Right.
They use this vibrating mesh to create this super fine aerosol, optimal particle size.
Nice.
This translates to better deposition in the lungs. So often, you need lower doses to achieve that desired effect. And as a bonus, they're silent, and they don't need an air compressor.
So less medication waste, better targeting, quieter operation. Sounds like a win-win-win.
They are pretty amazing. They do tend to be more expensive than other types of nebulizers, though, but our sources suggest that improved effectiveness often outweighs the cost, especially over time.
Makes sense. So if mesh nebulizers are at the top, what's next in this hierarchy?
Next up are breath-actuated nebulizers, or BANs. They're like a step up from the traditional small-volume nebulizers, or SVNs. BANs are designed to only release medication when the patient inhales, so that minimizes waste, improves efficiency.
So kind of the nebulizer version of taking a sip from a straw. You only get the medication when you're actually drawing a breath.
Exactly. And then finally, at the bottom of our hierarchy, you've got those traditional SVNs.
Right.
They're definitely the most widely available and the least expensive, but they're just not as efficient as those mesh nebulizers or bands.
So it seems like there's a bit of a trade-off between cost and efficiency.
Exactly. Now, there's one more important thing to consider when it comes to nebulizers, and that's their use with ventilators.
Oh, right. How do you deliver these aerosolized medications when someone's on a ventilator?
There are two main ways. The first is using an adapter that lets you connect an MDI directly to the ventilator circuit. The key here is timing. You have to actuate that inhaler at the right moment, synced up with the ventilator's breaths.
So it's like a delicate dance between the inhaler and the ventilator.
Exactly. Now, the second method is connecting a small volume nebulizer to that ventilator circuit.
Okay.
This can be effective, but it requires some adjustments to the ventilator settings.
What kind of adjustments?
For one, you need to turn off the flow trigger on the ventilator. Otherwise, the extra flow from that nebulizer might trigger all these unnecessary breaths.
Oh, okay.
And you also need to be super mindful of auto PEEP.
Auto PEEP.
That's a buildup of pressure in the lungs at the end of exhalation.
Got it. Why is that a concern?
Well, if the patient can't fully exhale before the next breath, the pressure from that nebulizer can actually worsen air trapping in the lungs.
Oh, wow.
So it's super important to monitor for signs of air trapping and make those adjustments as needed.
Wow, this is getting pretty complex. It's fascinating to see how this aerosol delivery is adapted for those patients on ventilators. It really shows the importance of that specialized knowledge and monitoring in respiratory care.
It absolutely does. And this brings us back to a key point. Understanding these nuances of aerosol delivery isn't just about these technical details. It's about empowering patients and their caregivers to advocate for the best possible care.
Exactly. So what you're saying is if you understand how these medications work, how they are delivered, and what the potential challenges are, you're better equipped to ask the right questions and advocate for your needs.
Exactly. And that can make a huge difference in receiving the most effective treatment.
I love that. It's about being proactive and informed in your own healthcare journey. Seems like we've covered a lot of ground today.
We have. We went from those basic concepts of particle size and breath holding all the way to the nuances of these different inhaler types and nebulizers. We've really gotten deep into the world of aerosol delivery.
And it's clear that proper aerosol delivery is crucial for maximizing the effectiveness of these respiratory medications and, ultimately, improving those patient outcomes. We've seen how these seemingly small details, like the force of your inhalation or the timing of actuation, can make or break how well these medications work.
Exactly. It's not just about getting that medicine into the body. It's about getting it to the right place, in the right form, at the right time. And that requires knowledge, attention to detail, and a real commitment to ongoing learning and improvement.
And speaking of ongoing learning,
There's always something new on the horizon.
yeah, for sure. Thinking back to that nebulizer hierarchy, those mesh nebulizers seem like they are top performers, but I imagine they aren't always available or affordable for everybody.
Right.
So for our listeners out there, what are some practical things they should consider when choosing a nebulizer?
That's a really good question. Ideally, everyone would have access to that most efficient technology.
Of course.
But realistically, cost, availability, and the individual patient needs are all part of that equation.
Right.
So, for example, if somebody needs frequent nebulizer treatments at home, a mesh nebulizer might be a worthwhile investment in the long run, even if it's a bit more expensive up front.
So weighing those long-term benefits against that initial cost.
Exactly. For others, a BAN, that breath-actuated nebulizer, might be a good balance between efficiency and affordability. And of course, those traditional SVNs, they're still widely used, especially in hospitals, and they can be effective when used correctly.
Right. And that actually brings up another point our sources emphasized. Technique, technique, technique.
Oh, yeah.
It seems like no matter what type of inhaler or nebulizer you are using, The technique can make or break the effectiveness.
It makes all the difference.
We've talked about timing, inhalation, breath holding.
Mm.
Are there any other tips or tricks that can help people get the most out of their medication?
You know, one thing that often gets overlooked is the importance of keeping those devices clean.
Oh, right.
Inhalers and nebulizers can actually become breeding grounds for bacteria if they're not cleaned properly. And that can lead to infections and reduce how well that medication works.
So it's not just using the device correctly, it's about making sure it's clean and working properly too.
Exactly.
Do you have any, cleaning tips for our listeners?
Most manufacturers will give pretty detailed instructions.
Sure.
But generally, it involves disassembling the device, washing those parts with some warm soapy water, rinsing them well, and letting them air dry completely. And some parts might need to be disinfected periodically.
So a little bit of regular maintenance can go a long way.
Absolutely.
Now, I want to circle back to something we touched on a little bit earlier, those potential side effects of these aerosolized medications.
Sure.
You mentioned albuterol and how it can cause that rapid heartbeat, irregular rhythms, even low potassium levels.
Mm.
Are there any other medications we should be aware of that could have systemic effects when delivered this way?
It's a really good point to bring up. You know, any medication has the potential for side effects, no matter how it's administered. But when we talk about aerosol delivery, we're basically bypassing that first-pass metabolism in the liver,
Right.
meaning the drug enters the bloodstream faster.
Oh, okay.
So this can make certain medications a bit more potent, potentially increase the risk of those side effects.
So it's not just the drug itself, but how quickly it gets into the bloodstream that can affect those side effects.
Precisely. And that's why careful monitoring is crucial, especially when you're using those higher doses or if someone has underlying medical conditions that might increase their risk.
So really working closely with your healthcare provider to find that sweet spot
Exactly.
where you're maximizing those benefits but minimizing the risks.
Absolutely. It's a balancing act, but definitely worth striving for. When used correctly and thoughtfully, aerosol delivery can be this incredibly powerful tool for managing a whole range of respiratory conditions.
Yeah, it's amazing to think about how far we've come in this field.
It is.
From those basic inhalers to these sophisticated mesh nebulizers, the technology has really advanced. And it seems like it's continuing to evolve rapidly. Are there any exciting new developments on the horizon that you are particularly excited about?
Oh, there's tons of exciting research happening right now.
Cool.
One area that I'm really interested in is the development of these smart inhalers.
Smart inhalers.
Imagine an inhaler that not only delivers your medication, but also tracks your usage, gives you feedback on your technique, and even reminds you when to take your next dose.
So it's like having a little personal respiratory coach built right into your inhaler.
Exactly. This type of real-time monitoring and feedback could be a game changer for improving adherence, making sure folks are actually using their inhalers correctly.
I can definitely see how that would be super helpful.
Oh, yeah.
It's one thing to be prescribed a medication, but it's another to actually use it consistently and correctly.
Right.
Smart inhalers could really help with that.
Definitely. And there's even more cutting-edge research exploring the use of nanoparticles for targeted drug delivery to the lungs.
Nanoparticles.
Yeah, like these tiny engineered particles carrying medication directly to those specific cells within the lungs. This could revolutionize the way we treat conditions like lung cancer, pulmonary fibrosis, even genetic disorders.
Wow, that sounds like something straight out of science fiction.
It kind of does, doesn't it? But it's becoming more and more realistic.
Wow.
The potential of nanotechnology in medicine is huge, and the respiratory system is a prime target for these advancements.
That's incredible. It really highlights how important it is for all of us to stay informed and proactive about our healthcare.
I couldn't agree more.
The more we understand about how our bodies work, how these medications are delivered, the better we can be at making those informed decisions about our own health. This has been such an insightful conversation. We've gone really deep into this world of aerosol delivery, from those basic concepts to some of the most cutting-edge technologies. I feel like I have a whole new appreciation for how complex and important this field is.
I'm glad to hear that. It's been my pleasure sharing these insights with you and our listeners.
Before we wrap up, do you have any final thoughts, any key takeaways you would like to leave our listeners with?
You know, I think the biggest takeaway is that when it comes to aerosol delivery, knowledge is power. The more you know about your medications, about your devices, about your own respiratory system, the better you'll be at advocating for yourself and working towards those best possible outcomes. Don't be afraid to ask questions, seek out guidance from those healthcare providers, and just stay curious about those latest advancements in the field.
That's a fantastic message to end on. Knowledge is power, And in the case of aerosol delivery, it can truly be the power to breathe easier, live better, and thrive.
Couldn't have said it better myself.
Well, I think we've covered a lot of ground in this deep dive.
We have.
It's been an amazing journey through this world of aerosol delivery.
And it's a journey that's constantly unfolding, right? Always new discoveries.
Always. It feels like our listeners have gotten a real deep dive into this topic. What stands out to you as, like, the most crucial point for them to remember?
I think one of the biggest takeaways is that aerosol delivery, it's not just about the medication.
Right.
It's about the device, the technique, the patient's individual characteristics, and how closely their providers are monitoring their progress. It's a real team effort. Requires a deep understanding of how all these pieces fit together.
It's a good reminder that healthcare is rarely one size fits all. What works for one person might not work for another. That's why that clear communication and shared decision-making are so important.
Absolutely. And, it's inspiring to see how technology is changing things. Those smart inhalers, the nanoparticles, all these innovations we talked about, it really feels like we're at the beginning of something big here.
It's pretty exciting to imagine what's possible. It seems like we're on the verge of having even more personalized and targeted ways to approach respiratory care.
Yeah, we really are.
Well, I think we've covered pretty much everything we wanted to explore in this deep dive into aerosol delivery.
I think so.
As we wrap up, is there anything else you'd like to share with our listeners? Any last words of wisdom?
I guess just this. Never underestimate the power of knowledge when it comes to your health. The more you understand about your respiratory health, your medications, these new advancements, the better you'll be able to advocate for yourself and get the care that's right for you.
That's such a great reminder. Knowledge is power. And especially when it comes to respiratory health, it really can be the power to breathe easier, live better, and thrive.
Well said. Couldn't agree more.
And to all our listeners, thank you so much for joining us for another deep dive. Remember to like and subscribe to the channel so you don't miss our next episode. For more exclusive content, check out our Patreon below for details. See you next time.